Welcome to the Healthy Pantry, your daily dose of nutritional knowledge and wellness inspiration. We are delighted to have you here. In today's video, we're diving deep into the magnificent world of parasites and exploring the warning signs that indicate they might be lurking in your body. So, what exactly are parasites, and what do they do to our bodies? Parasites are organisms that live on or inside another organism, known as the host, and derive nutrients at the host's expense. These organisms come in various forms, including protozoa, helminths, worms, and ectoparasites like ticks and lice. Once inside our bodies, parasites can wreak havoc in numerous ways. They can disrupt our digestive system, leading to issues such as diarrhea, constipation, bloating, and gas. Some parasites feed on our blood, causing anemia and weakness. Others can migrate to different parts of the body, causing muscle and joint pain, or even affecting our mental health, leading to symptoms like anxiety and depression. In today's video, we'll discuss the warning signs that may indicate the presence of parasites in your body. By being aware of these signs, you can take proactive steps to protect your health and well-being. So, let's dive in and learn more about these fascinating yet potentially harmful organisms. Stay tuned for valuable insights and practical tips to help you maintain a healthy and parasite-free body. First off, let's talk about digestive issues as warning signs of possible parasitic infections. Parasites can disrupt the normal functioning of the digestive system, leading to chronic diarrhea or constipation. This can occur due to inflammation in the intestines caused by the presence of parasites or their byproducts. They can interfere with the normal digestion and absorption of food in the intestines, leading to increased gas production and bloating. Parasites may also cause irritation or inflammation in the gastrointestinal tract, resulting in abdominal pain or cramping, especially after eating. Some parasitic infections can trigger nausea and vomiting, particularly if they affect the stomach or upper intestines. They can damage the intestinal lining, leading to increased intestinal permeability or leaky gut syndrome. This condition allows toxins, undigested food particles, and pathogens to enter the bloodstream, triggering immune responses and inflammation. In severe cases, parasitic infections may cause gastrointestinal bleeding, which can result in symptoms such as bloody stools or vomiting blood. Large parasitic infections or the formation of intestinal blockages due to parasites can lead to symptoms of intestinal obstruction, such as severe abdominal pain, distension, and constipation. If you experience any of these digestive symptoms persistently, it's essential to consult a healthcare professional for proper evaluation and diagnosis. Testing for parasites typically involves stool samples, blood tests, or imaging studies, and treatment may include antiparasitic medications and supportive therapies to alleviate symptoms and restore gastrointestinal health. Did you know that unexplained weight loss can be a concerning symptom and may indicate the presence of parasites in the body? Parasites living in the gastrointestinal tract can interfere with the absorption of essential nutrients such as carbohydrates, fats, proteins, vitamins, and minerals. This malabsorption can lead to weight loss despite consuming an adequate or increased amount of food. Some parasites can increase the host's metabolic rate, causing the body to burn calories at a faster pace. This accelerated metabolism can lead to weight loss even without a decrease in food intake. What's more, parasites consume nutrients from the host's body for their survival and reproduction. As a result, there may be competition for nutrients between the host and the parasites, leading to malnutrition and weight loss in the host. Certain parasitic infections can cause loss of appetite or aversion to certain foods, contributing to reduced calorie intake and subsequent weight loss. Parasitic infections in the gastrointestinal tract can cause chronic diarrhea, leading to fluid loss and dehydration. While this may not directly result in weight loss, it can contribute to a decrease in overall body weight. In severe cases of parasitic infections, especially those caused by certain types of worms or protozoa, the host may experience cachexia, a wasting syndrome characterized by severe weight loss, muscle wasting, weakness, and fatigue. Parasitic infections can disrupt metabolic processes in the body, leading to alterations in energy metabolism and utilization. These metabolic disturbances can contribute to weight loss as the body struggles to maintain normal physiological functions. Some parasites can trigger chronic inflammation in the body as part of the host's immune response. Chronic inflammation is associated with metabolic changes that can lead to weight loss and muscle wasting over time. Additionally, fatigue is a common symptom associated with various parasitic infections. Parasites feed on the nutrients present in the host's body, leading to nutrient depletion. Essential nutrients such as vitamins, minerals, proteins, and carbohydrates are essential for maintaining energy levels and overall health. When parasites consume these nutrients, the host may experience fatigue due to deficiencies. They release toxins as byproducts of their metabolic processes or as a result of their interactions with the host's tissues. These toxins can disrupt normal physiological functions, including energy metabolism, and contribute to fatigue and malaise. The host's immune system responds to parasitic infections by releasing inflammatory mediators and activating immune cells to combat the invaders. This immune response requires significant energy expenditure and can contribute to feelings of fatigue and exhaustion. Certain parasitic infections, particularly those affecting the gastrointestinal tract or the nervous system, can disrupt sleep patterns. Sleep disturbances such as insomnia, frequent awakenings, or restless sleep can lead to daytime fatigue and reduced energy levels. Severe parasitic infections can cause damage to organs and tissues, leading to dysfunction and impaired energy production. For example, liver damage caused by certain parasites can impair the synthesis of essential molecules involved in energy metabolism, leading to fatigue. But wait, there is more. Skin problems can be an indication of certain parasitic infections. Here's more information on how parasites can contribute to skin problems. Some parasitic infections can trigger allergic reactions in the body, leading to the development of rashes, hives, or welts on the skin. These reactions may occur as a result of the immune system's response to the presence of parasites or their byproducts in the body. Chronic parasitic infections, particularly those affecting the gastrointestinal tract, can disrupt the balance of microorganisms in the gut and lead to inflammation. This systemic inflammation can manifest as skin conditions such as eczema or dermatitis, characterized by redness, itching, and scaling of the skin. Parasitic infections, especially those involving ectoparasites like mites, lice, or fleas, can cause intense itching of the skin. This itching may be localized to specific areas of the body or may be widespread, depending on the type of parasite involved. Some parasitic infections, particularly those caused by protozoa such as Leishmania or Trypanosoma, can lead to the formation of skin ulcers. These ulcers may be painless or may cause discomfort and can become secondarily infected if not treated promptly. Imbalances in the gut microbiota resulting from parasitic infections can contribute to inflammation and hormonal disturbances, which may exacerbate skin conditions such as acne or rosacea. If you find this video helpful and informative, please support the Healthy Pantry channel by leaving your comment below, liking this video, and subscribing for more daily health and nutrition tips. Moreover, muscle or joint pain can be associated with certain parasitic infections. Some parasitic infections involve the migration of larvae through the body's tissues, including muscles and joints. The movement of larvae can cause inflammation, tissue damage, and pain in the affected areas. Certain parasites, such as the larvae of the pork tapeworm, Taenia solium, can form cysts within muscle tissues. These cysts can grow over time, causing pain, discomfort, and inflammation in the surrounding muscles and joints. Parasitic infections can trigger an immune response in the body, leading to inflammation of the muscles and joints. This inflammation can cause pain, stiffness, and reduced mobility in the affected areas. As we mentioned before, they consume nutrients from the host's body for their survival, leading to nutritional deficiencies in the host. Deficiencies in vitamins and minerals essential for muscle and joint health, such as vitamin D, calcium, and magnesium, can contribute to muscle weakness, pain, and cramping. In some cases, the body's immune response to parasitic infections can result in autoimmune reactions, where the immune system mistakenly attacks the body's own tissues, including muscles and joints. This autoimmune response can lead to inflammation, pain, and damage to the affected tissues. Infections with parasitic worms, such as filarial worms, can lead to the formation of nodules or cysts that press on nearby nerves, causing pain, tingling, and numbness in the affected areas. Moreover, anemia, a condition characterized by a deficiency of red blood cells or hemoglobin in the blood, can be a warning sign of certain parasitic infections. Parasites that feed on blood, such as hookworms, roundworms, and certain protozoa like Plasmodium, malaria parasite, can cause anemia by consuming red blood cells or hemoglobin. These parasites can lead to significant blood loss over time, resulting in iron deficiency anemia. Parasitic infections in the gastrointestinal tract can interfere with the absorption of iron, a vital nutrient for red blood cell production. Chronic gastrointestinal bleeding caused by parasites or inflammation of the intestinal lining can lead to iron deficiency anemia, characterized by fatigue, weakness, pale skin, and shortness of breath. Parasites in the gastrointestinal tract can disrupt the normal absorption of nutrients, including iron, folate, and vitamin B12, essential for red blood cell production. Malabsorption of these nutrients can lead to anemia and associated symptoms. Parasitic infections can disrupt the bone marrow's ability to produce red blood cells, leading to decreased erythropoiesis, red blood cell formation. This impaired production of red blood cells can result in anemia and related symptoms. Lastly, visible signs of parasites in stool can be an indication of certain parasitic infections. Here's more information on what to look for and how parasites can manifest in stool. Some parasitic infections, such as intestinal worms like roundworms, tapeworms, and hookworms, can produce visible worms or segments of worms in stool. These worms may appear as whitish, yellowish, or brownish in color, and they may vary in size depending on the type of parasite and stage of infection. Parasitic worms often release eggs into the intestinal tract, which may be shed in the stool. These eggs are typically microscopic and may not be visible to the naked eye. However, in some cases, clusters of eggs may be visible in stool, particularly if the infection is severe. Certain protozoan parasites, such as Giardia and Cryptosporidium, can form cysts that are shed in the stool. These cysts are usually spherical or oval in shape and may be visible as small, translucent, or opaque structures in the stool. Tapeworms consist of multiple segments called proglottids, which contain eggs and reproductive structures. As tapeworms mature and grow, these segments may be shed in the stool and appear as small, flat, whitish, or yellowish segments resembling grains of rice. What's more, some parasitic infections, particularly those causing inflammation or damage to the intestinal lining, can lead to the presence of blood or mucus in the stool. Blood in the stool may appear as red or dark brown streaks or spots, while mucus may appear as a gelatinous or slimy substance. Parasitic infections in the gastrointestinal tract can produce foul-smelling stool due to the release of metabolic byproducts, fermentation of undigested food, or secondary bacterial overgrowth. Parasitic infections can cause changes in the consistency of stool, such as diarrhea, loose stools, or constipation. Diarrhea may be watery or contain mucus, while constipation may result in hard, dry stools. It's essential to note that the presence of visible signs of parasites in stool may not always be indicative of an active infection. Some individuals may pass parasites or parasite-related material in stool even after successful treatment of the infection. However, if you notice any unusual or persistent changes in stool appearance, it's important to consult a healthcare professional for proper evaluation and diagnosis. And there you have it, folks. As we conclude today's video on warning signs that you may have parasites in your body, it's crucial to remain vigilant and proactive about your health. If you've noticed any of the symptoms mentioned, it's essential to consult with a healthcare professional for proper evaluation and treatment. In tomorrow's video, we'll be diving into a fascinating topic: herbs that have been traditionally used to expel parasites from the body. We'll explore how these natural remedies work, their potential benefits, and how you can incorporate them into your wellness routine. So, be sure to tune in tomorrow as we continue our journey towards better health and well-being. And remember, taking proactive steps to maintain a healthy lifestyle is key to keeping parasites at bay. Stay tuned, stay informed, and stay healthy. See you in the next video. Thank you for joining us here at the Healthy Pantry. We hope you found the information valuable and inspiring. Remember, your health is a journey, and we are here to guide you every step of the way. Thank you for watching, and we will see you in the next video.